So we're always going to identify our patient by agency protocol. We are also going to follow state and federal regulations. We are going to abide by standard procedures or standard precautions, make sure that we're wearing gloves, hand hygiene. We are going to ensure patient safety and privacy, as well as promote good body mechanics. So when performing a tracheostomy sectioning, we are going to be positioning our patient in a semi-phallic position. We're going to be placing a linen saver on the patient's chest. We are also going to make sure that we have goggles or face shield. And then we are next going to be turning on our suctioning machine. We're going to adjust it so 100 to 150 mm HG for adults, 100 to 120 for children, 50 to 95 for infants. And then we are going to test our suctioning by occluding the airway here. After we're done, we are going to thoroughly our gloves. And then we are going to gather our supplies for our sterile field for the catheter suctioning. Opening our catheter suctioning kit, we are going to be donning sterile gloves. We are going to be considering our non-dominant hand as the contaminated hand or the dirty hand. And then our dominant hand is going to be considered our clean hand. So I'm going to pinch the outside, step away from our sterile field, keep our hands above our waist. And the other one, we're going underneath the cuff, standing away from our sterile field, above our waist. Be picking up our catheter suctioning tube with our non-dominant hand, since it is considered non-sterile, and then we will be picking up the catheter suctioning tubing with our dominant hand, which is our sterile hand. And then we are going to be placing the catheter suction into the suctioning tubing, keeping sterility of our dominant hand. Once we have our connection tubing all together, we are going to then, with our non-dominant hand, we are going to be pouring the saline solution. So we're not going to be reaching across our sterile field. We're going to go out and around, and we will pour. And then we are going to be occluding a small amount of the normal saline solution into the tubing. So we're going to be using our non-dominant hand to occlude. And suction the small amount of saline into the tubing. If the patient is receiving oxygen, we are going to be hyper oxygenating them. If they are on a ventilator, then we are going to put 100% O2. If not, we are going to use a resuscitation bag, and we will attach it to the tracheostomy. And perform it manually. If the patient is not on a ventilator, then we would use the resuscitation bag, and we would compress it 3 to 5 times. When we're done with the resuscitation bag, we're just going to keep it at the patient's side. Next, we are going to be performing our suctioning. So when entering, we are going to be entering gently, but swiftly. We are going to go down to the prescribed measurement, no more than 6 inches. When we are inserting, we are not going to be occluding. We are suctioning. We are going to be moving up and down in a circular rotation. We're going to be occluding with our non-dominant hand. We are going to make sure that we are keeping our sterile hand away from the Trach site. With each suctioning, we are going to make sure that we're not doing it over 15 seconds. We're going to give 30-second intervals in between suctioning, and usually we're not going to do it more than 3 times. We're going to limit our total suctioning time to 5 minutes. We are going to make sure that we are hyper-oxygenating our patient between every suctioning interval. We're done with our suctioning procedure. We are going to coil the catheter tube in our dominant hand. We are going to clear the secretions out of the suctioning tube by putting it in our normal saline solution. When we are done with that, we are going to then remove the non-dominant hand glove to dispose of the catheter suctioning tube. We would remove our gloves. We would, of course, make sure that we're properly disposing all of our materials, our used materials. We're going to be making sure that we wash our hands, that our suctioning machine is turned off, denoting the color, the consistency, the odor and amount of secretion. We'd also note how the patient tolerated the procedure. We'll also be assessing lung sounds and the SpO2 level. We are going to be setting up for our tracheostomy care sterile field. So the first thing we're going to do is we're going to pick up our gloves and set it on our table. Using our sterile technique, we're going to put on our gloves. So we're going to pinch the inside, step away from our sterile field, keeping our elbows and wrists above the waist. And then with our gloved hand, we're going to go ahead and go inside the cuff, stepping away again from our sterile field, keeping our elbows and wrists above the waist. We're going to take our drape that we have inside our kit here. We are going to put it shiny side down. And then we are going to be emptying the rest of our supplies. So with our gauze, we're going to be separating, making sure that we're staying within our sterile field. Your strap, pull around and drop. We're going to be making sure that everything is facing towards the center of the sterile field, and as we use it, we're going to be placing it towards the outer side of the sterile field. So the Q-tips are going to go out and around. These are going to go here. I have my pipe cleaners in the biggest compartment. My brush is going to be located in the middle-sized compartment, and then my Q-tips are going to be in the smaller end of the compartment. First thing we're going to do is we're going to establish that our non-dominant hand is going to be our non-sterile hand. So using our non-dominant hand, we are going to take the lid off and come over to our sterile field. The only one that gets the hydrogen peroxide is our middle compartment here. And after we have done the peroxide, we're going to come around and we're going to get our saline, sterile saline, and we are going to pour in all the rest of the compartments, not reaching around our sterile field. We are going to only put half into the middle-sized compartment because it already contains the hydrogen peroxide. Patients receiving oxygen, we are going to use our non-dominant hand to remove the humidifier or oxygen source. If we can, hook up the oxygen source to the outer cannula we should do so. If that's not possible, then we're going to have a respiratory therapist set up that oxygen blow-by. With our non-dominant hand, we are going to remove the cannula here. So, and make sure that we're holding the trach in place with our middle finger while we're taking it out. Once we have it removed, we are going to first place it in with our half and half solution using the brush. We are going to be cleaning the inside and outside of the piece, making sure that we're getting the outside of it as well. When we are done with it, we're going to make sure that it is facing out towards the outside of the sterile field. And then we are going to come over to our pipe cleaners, and we are going to get rid of that peroxide solution, doing it from the inside as well as doing the outside of the tubing. And then we're going to place that way. So when placing it back in, we want to make sure that we are putting it downwise. We're going to start this way, and it's going to loop around until we hear it kind of click. So we're going to turn it until we hear a click, and the two dots line up to say that it is locked. So we're going to go ahead and use a Q-tip. We are going to be cleansing around the stoma site with our Q-tip. And we're going to grab another one. We're going to even be doing the outside, the faceplate, lifting up on tracheostomy a little bit and going underneath. We're going to be also assessing the stoma site. So we're going to come over, and I'm going to use my non-dominant hand to hold down the tracheostomy. I'm going to be undoing the Velcro or the string or whatever, and tucking it back. I'm going to take my gauze pad. I'm going to be dipping it in my saline solution, and we are going to be cleansing the neck area on the side that I removed the strap. So we will clean it, and then we will also dry it. We're going to be taking our new strap and putting it in place. We are going to be continuously holding on to our trach. And then we are going to be taking the old one off and disposing it with new clean swabs. We are going to also do the same thing as we did on the other side. We're going to be cleaning and then drying. And then we are going to be putting the other side. When we're coming in from the other side, we are going to double up on our strap here. This is broke, so it's a little hard to demonstrate, but we are going to then tie it off. And we're going to make sure that it's tight, not too tight where it's cutting off circulation or anything or blood flow, but we want to make sure that it's tight and secure around the neck. And then when you're finished, we can also use our gauze pad and place it underneath our trach site. When replacing a disposable, keep in mind that our right hand is still sterile. We are going to already pre-pack it or pre-open our package for our new one. In removing, we are going to make sure that we're using our non-dominant hand, which is our non-sterile hand, and we are going to remove the old piece. We could just pull on this little ring that's up here and remove. And then we would dispose of it, and then with our sterile hand, we would then pick up the new one, and we would place it just like we did previously with the other one, facing down and looping it through And so we hear a click.